I wish you good evening and Happy New Year to all of you, and bring you tidings of good joy, and feeling pretty good. We just got in our COVID vaccines today, and I took the first shot to set the example for the folks that we serve, and 300 doses of Moderna, and we are totally excited about that. But in that vein, I wanted to come and give you a report and to announce to you tonight that the results of the testing, and I want to thank the mayor and the council and the fire department and all the citizens of Patterson. Just to give you a little bit of background, we were notified back in May that Teche Clinic would be granted 1,000 test kits that included the PCR, which is acute testing for COVID, as well as serum testing. It was a grant that was sponsored by Centene Corporation in conjunction with the National Minority Equality Forum and Harvard University. They only selected 5 sites in the United States, 5 states, and Teche Clinic was the only clinic in Louisiana selected. Called the mayor immediately, way back in May, because they wanted us to do it within 2 weeks. Well, those 2 weeks turned into like 4 months because we had to get approval and reapproval, and they changed the format. But, you know, you all remain totally committed to the process. We worked out the logistics. And the way that the 1,000 test kits that they have given to us, we have 16 locations, but I knew it would spread too thin, so we confined it to St. Mary Parish. We tested all of the patients that come through our clinics in Franklin and Morgan City, and then opened it up with the mobile unit to have a community testing at Franklin Recreation Center, Patterson, here at the fire station, and in Morgan City. And I must report that Patterson exceeded all the other community testing sites. You had the highest. You were allotted 100, you did over 150. The benefit that has come out of that, and I apologize because I know what happened was we got so jammed up with so many people, we couldn't get the reports out as quickly as we'd like to. But I did try to respond to any texts for the ones we did. Out of that study, we identified 120 people that had convalescent serum. And we have a blood mobile drive tomorrow. We have 20 people coming to donate their blood, their serum, which means they have the antibodies to fight COVID. It's the most valuable blood you can have because it could save a life. And these folks have volunteered to donate. So, you know, that's globally out of the whole parish, but quite a few of those folks are from this area. And so I want to, again, thank you all because the generosity of the people in St. Mary Parish and Patterson in particular just humbled me. To a person, when they were told that they had the antibodies, the response was, if I can help someone or save someone's life, I will do it. Not one person turned us down. So, and we are going to continue to do that as we move forward. And let me just say this, we're working with the Office of Public Health, Dr. Riggins, you all know Dr. Chip Riggins. We worked with them during this process as well as the National Board. And I sit on the Governor's Health Equity Committee and some other committees, and we're trying to put together, as you all know, everyone's calling us about the vaccine. It's been a logistical challenge. To use some other adjectives, but I'll just say challenge, that have led to some opportunities. We've made ourselves available, just as we did with our mobile unit. If we can work out the logistics, making a commitment tonight that we are available to put our mobile unit here in Patterson and to try to do mass vaccinations once we get this thing going, because the only way we're going to get our way out of this is to vaccinate people in this country. To achieve herd immunity, we have 330 million people in the country. We're going to have to get at least about 240 million people vaccinated to really have some confidence that we can turn the corner on this thing. That's in addition to obviously doing what we're doing tonight, socially distanced, wearing masks, practicing good hygiene, and not doing super spreader events. So we are in conversation with the Office of Public Health, the Governor's Office, and we would like to be a part of that plan. I'm just putting that out there that we're hoping that we can work that out and then make that available to the citizens, particularly in rural communities, because as you all know, competing with urban centers becomes a challenge. They get things in the larger cities before we get sometimes, but you have people out there fighting for them. On another note, I just wanted to give you a report also on the relationship we've had historically with Patterson. And we have our board president, Mr. Leroy Willis, here tonight. Just to let you all know, Teche Clinic has been around 46 years now, and we're in 16 locations, like I said. We serve about 1,200 people from the Patterson community that we are active patients. And that commitment is one that we take very seriously and appreciatively. So much so that we've talked historically about trying to have a more physical presence in Patterson, and that's something that our board of directors and myself are looking to try to bring to bear in the coming months. So that's something that we feel that would be beneficial to make it the access even more available to you. So I don't know if Mr. Willis wants to say a few words regarding that in particular.
Good evening. Good evening. Thank you, Mayor Brogan and council persons for making sure City of Patterson received our COVID testing. As Dr. Willis said, you had the largest turnout. And once again, congratulations on that. Teche is the oldest health center in the state of Louisiana. We've been around, as Dr. Willis told you, for 46 years. We have school-based clinics, and we have regular clinics. We've always had a good working relationship with Patterson. The Mayor Grogan has always come out, and the mayors before him has always come out when we do our proclamation to sign, saying that they are in support of us. And we would like to continue to forge ahead with a good working relationship with those that live here in the city of Patterson. We have quite a few that travel either to Morgan City or to Franklin to receive services from us. We are one-stop shop. We can keep you from your brains all the way to your feet. That's the service that we offer at our clinics. We also do dental and mental health behavior. So I'm just here to urge you to continue seeking out Teche Action Clinic as your medical, dental, mental providers. I hope we can continue to grow here right in the city of Patterson, so it'll be a win-win for you, citizens, as well as Teche Clinic. Y'all have a good evening.
Thank you. Mr. Mayor, if there's any questions that anyone has, I'll be happy to answer them. I know there's been a lot of inquiries and questions that we've received regarding the vaccine and when it's going to become available. Unfortunately, it's been a logistical nightmare because the request had been set up to the CDC. It's not, and let me just give a shout out. The governor has been phenomenal, as well as the Department of Health. The holdup is not with the state, it's with the CDC allotting the vaccines. We were supposed to have done 20 million vaccinations by the end of December. We only did 2.7 million. So it does don't want any good for the sitting refrigerations or freezers. We've got to get into people's homes. We've got to get folks vaccinated. There are some ambitious plans with the incoming administration to do a million vaccines a day. We are on some of those planning committees, and as I said earlier, we will make ourselves available to do whatever we have to do to try to get that accomplished. But if anyone has any questions, I'll be happy to answer them for you regarding our services or COVID.
Well, Doctor, I heard you basically say you took the Moderna.
Yes, I did.
Okay. And you know Pfizer came with that.
That's correct.
Okay. Do you know specifically which one has been, because we know there's no pharmacists that were actually provided with the vaccine for 70 and older, because that's the cost that we're getting.
That's correct.
But we do know some hospitals may be. Do you know which one they will be doing, Pfizer or Moderna? And why did you take Moderna?
That was the one, when we tell people to get screened for colorectal cancer, I was on the national committee, the statement we should make, what is the best test? The one that gets done.
Yeah.
The best vaccine is the one that you get available and you can get to first. So Pfizer, and let me just back up because I really, and thank you for this opportunity because there's so many myths out there about vaccines in general. The vaccines do not cause you, will not give you the disease. The flu vaccine, the pneumonia vaccines, and the measles, mumps, rubella, it doesn't cause autism. I know there are lots of people that get information that's incorrect. And so the vaccines, in particular, the technology that developed Pfizer and Moderna was called messenger mRNA. And generally what you do is you take a piece of the vaccine, you will manufacture it so your body, it's not the live vaccine, it's a piece of it that the body can recognize and develop antibodies to fight. So it indoctrinates you to be able to recognize it and kill it and fight it when it comes on. It's science. And the technology, they misnamed, I would have never named it warp speed. That was a bad name. We should have never named it that. But the technology that we developed, these vaccines, clinical trials, I read all the studies, the science is solid. Okay? Pfizer, that product is a little bit, I don't want to use the word unstable, but you have to freeze it so deeply that when you thaw it, you have to give it a short time frame. Logistically, that's become a problem. We couldn't even accept it because we didn't have the facilities. Moderna is not that way. It can be refrigerated. And so when we were in line, that's the one we got. Now, those were made with that technology. The AstraZeneca one is one that was made with a different technology, but still one that we had used previously. Pfizer and Moderna is 95% effective. I don't know if you all visit Olivia Bell or Cypress Bayou Casino, but that's a hell of a lot of 95% effectiveness. That's a hell of an odds that you can't beat. You know, if you can decrease your risk to 5% of getting the COVID by taking the vaccine, the flu vaccine at its best we can do is about 65%. So these vaccines are very potent and powerful, and we just have to produce enough of them and get them to enough folks. Now you do have to do with the Pfizer and Moderna. The AstraZeneca is going to be a one dose, and then Johnson & Johnson has one behind that one. So, I hope that answers your question. Moderna and Pfizer, the same type of technology, messenger mRNA. AstraZeneca, the more traditional type, and when Johnson & Johnson, the same way. But that's four, but there's some other companies making them also.
The Pfizer, the actual ability to keep it at its temperature and so forth is a concern for most of the people that I've spoken with. And then I thought it would be easy just with the Moderna. Just one shot, you said 2 doses. I thought that was easy. But those are the concerns that I've been hearing and so forth, because what we've heard, and of course, the television can be outburst, the media, and no insult to their review and to KBC. But the media put out there, if it's in the wrong hands, and someone intentionally dropped the temperature, took it out, and so forth. So you had 500 people that possibly they were given the vaccine, and then come to find out some joker actually. Yeah.
Well, whenever you have humans involved, human error is always going to be a factor. I don't know if that was intentional or I guess they're still investigating, but that is going to happen even under the best of circumstances. The thing that I hope people don't do is play Russian roulette with this. And when they ask me, well, I know someone had it, didn't have any symptoms. I don't know. It's like people say, I know somebody smoked 4 packs of cigarettes a day and they lived to be 90. I can walk out to the cemetery and show you hundreds of people who smoked tobacco there for 20 years and died. I have 2 words for people that say that, and that's bring it home. And I know you did a memorial in the beginning. Luke Ledlow, Louisiana's newest congressman-elect, 41 years old, no pre-existing conditions, got COVID, and all this conspiracy theory about with padding the diagnosis. He died from a cardiac event caused by COVID. His death certificate is going to read cardiac condition, and COVID is the thing that caused that cardiac condition. We don't know why, but it's causing heart attacks in young people, strokes in young people. It does something to the blood vessels in a way that causes inflammation that's setting them up for these events that we don't quite understand. So it's not padding the diagnostic code. You have to list that if someone tested positive. And I hope that makes some clarity, because people keep saying, well, doctors are making it up and adding to that. You have to list it, you know, as a cause and effect. So I hope people take it seriously and continue to take it seriously. America is the greatest country in the world. I have no doubt that we will be able to get our way out of this. As a matter of fact, I have more concerns on a larger scale with the World Health Organization because there are other countries that have they're not anywhere on the list. It might be 3 or 4 years before they get the vaccine. And we don't live in a vacuum, so we're going to have to think globally on some of these things that we're doing. But for tonight's purposes, I'm here to tell the citizens of Patterson that we're here for you, with you, and I'm hoping that we can work this out. But if we do, we'll be happy to put the mobile unit out here and start, offering vaccines. It's free, it's voluntary, I think the science is good. Some people have like soreness I don't even have any soreness at the site of my injection. Some people have like headaches and fever or some mild muscle aches, and that usually lasts 24 hours. You take 2 Tylenol, it generally relieves it, but the protection and the peace of mind that you get by having a vaccine that's 95% effective, just to know that you have that protection is just worth its weight in peace of mind. So,
Dr. Willis, is this a one-time vaccination, or is this something that has to be repeated? I mean, how
we're going to be able to tell as we track people. We did the clinical trials, and the people that we were testing that had the immunity, some of them had it for 6 months, but we don't know how long it's going to last. We don't know if this is going to be like the flu vaccine where we have to give it every year, or it's going to be like the pneumovax that you take every 5 years. We're going to keep following and tracking and looking at the immunity. That's why I'm really so appreciative of the work of the people that participated, because part of the study that we're doing with Harvard is looking at the genetics of that, and then we're going to study that in a subset. So more than likely, it's looking like it's going to be a yearly sort of vaccine, like the flu shot. I'm sure you all saw there was a mutation already. Viruses do that. The vaccine, all the research so far shows that the current vaccine is still effective even against the mutated version. So that's something we have to take a close look and monitor. But to answer your question, I think it's probably going to wind up being a yearly vaccine.
All right. I do want to say this, Mr. Willis, you put a pitch there, and I do want, because I know you were kind of passionate, and there are some people wondering about what they read in the newspaper on last month in regards to nurse practitioner open here. I will say that it's not going to be on our premises, but it is, they're moving forward. So, and we live in a competitive environment and so forth. As I hear you saying, you have the mobile unit, whatever you can do, but I do want to say, because I don't want within the next month you hear that ground has been broken for, because that's something we can't stop.
Right.
But, I did hear the conversation and the dialogue and so forth. You have your mobile unit, you have.
No, we're committed to Patterson. We've always been, we had plans available to do some work out of Patterson Junior High, Patterson. We've always done work with them. We will continue to do that work and offer the array of services that Mr. Willis described. We're about to start a big initiative parish-wide on mental first aid, working with law enforcement, because I can tell you right now, there's a lot of substance abuse disorders. There's a lot of mental health first aid where families do not know what to do. They have relatives that all they can think of calling law enforcement. If law enforcement isn't trained to de-escalate or have mental health professionals with them, then they have to control the situation and environment. If that team included mental health professionals, then I think we can have a much better outcome. And that's an area that we are actually going to take the charge on. You're going to see if the funding that's been proposed comes true, we will be having some grants and initiatives that will be engaging the whole community. Not only the coroner's office, but what's the primary diagnosis? People that have severe mental illnesses, You never put law enforcement in a position, or family members in a position where they have to beg, please don't shoot them, please don't restrain them. You know, it doesn't have to come to that if we are proactive and we recognize that. So we're putting together a coalition that's going to be, you'll be seeing as we roll this out. But there are lots of issues in the community that I think we could work together that we're aware of.
Mayor, we're not worried about competition. We just want to make sure the citizens here in Patterson receive the best health care they can.
Oh yeah, competition. We've been around, you know, if you go back to 1965, community action, Head Start, community health centers, we were all experimental programs that Medicare, Medicaid, all those were experimental social programs that folks didn't think would work. With longevity is a testament of value. And here we all are, you know, some 50 years later, and not only still providing services, but expanding the services. So it's all about serving the people. It's not a personal glory, anything like that.
Well, I don't end it on a good note because you got 3 babies from 65 here now. I don't think we did quite well. We were born at 65.
But let me congratulate you all. Look, I say this, and I know I've seen you and I been up on Capitol Hill together, you know, and I always tell the, you know, our congressmen and United States senators, the most respect I always have for local elected officials, because they know where you live. They know where each one of you lives. They're not a knock on your door. They can touch you, feel you. You're the most responsive that, you know. So policy matters and the people matter. You know, Lyndon Johnson didn't treat a patient in his life, but he enacted that Congress. He enacted Medicare and Medicaid, Head Start, community action, community health. So the policy that we make matters, and the fact that you're part of the community, I have the utmost respect for. So continue to do the work that you do. Thank you.
Doc, we appreciate it.
Thank you.